Hello, Village's Honor Flight. Hope you all had a great Thanksgiving and welcome to the December video. As we always do, we're going to start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now we'll have a moment of silence for those that have departed. Okay. So today we have a special treat. We're going to get a presentation from our chairman of the board, Joe Hambright. So Joe, over to you.
Thanks, Al. I appreciate being invited to talk to the December meeting of the Village's Honor Flight Club. I know in the last meeting we discussed or tried to discuss where we're going in the future, and I answered 3 questions with the same answer: we really don't know. Well, things are starting to happen a little bit now. The management team, and my kudos to the management team, are working very hard to start putting together some plans for next year. And I know when I'm finished talking, Lisa Walters is going to be speaking, and she will give you some tentative idea of what their thought processes are. I know it's been a difficult year, and ever since February, we've been in this long tunnel. And every time we see this light at the end of the tunnel, it ends up being a train and just running right over us. Well, this time the light at the end of the tunnel is called a vaccine, and it looks like it's starting to be distributed yesterday and today. And maybe that light really is going to be the light at the end of the tunnel and will allow us to get back into our activities. I want to discuss a couple of other things today, but the first thing I want to comment on is our concern for maintaining the health and safety of our members and our veterans. The board of directors is made up of a group of people, all of which have some sort of a data fact-driven background in their work lives. And I want to make sure everybody understands that our decision as to when we will be able to get back into action will be fact and science driven and not emotionally driven. Because like I said, the health of our veterans is really number one in our minds. I also want to introduce Mary Ann Parker to the board of directors. I know a number of you have seen Mary or met Mary Ann in the past. She was one of the original medical coordinators for Village's Honor Flight and was responsible for helping to develop the medical group into what it really is today. She has agreed to step in and join us on the board, and I think you read about that in our last newsletter. So when you get an opportunity, thank Mary Ann for taking on the responsibility of joining our board of directors. I know we're anxious to get going, but I have an interesting fact for everybody. We're all interested in getting our vaccine and getting it into distribution. But if they make 1 dose per second, it's going to take about 117 days to make 1 million doses. So it's going to take a while to get that vaccine, so be patient and be safe. Another item I want to talk about is we're reaching the end of the year, and a number of coordinators and our volunteers are starting to move on to other functions and other jobs. And that's pretty much normal. People agree to do something for a year or two and then they move on. So right now there is an opportunity for a lot of people to get involved as coordinators, assistant coordinators, and flight staff. We're really anxious to get more and more people involved with the flight staff. And if you have any interest in doing that, Ms. Walters is the person to go to for that. So what else do I want to cover? I just got the phone call from Jeff saying, hey, you're on right now, and actually I was planning to be on tomorrow, but due to a mistake in my calendar, I'm a little discombobulated as far as what I want to talk about, but I did scratch out a few notes as I was running around getting ready for Jeff. So like I said, be patient. We will get going. Be safe. Have a happy new year. I do have a request though. I would like everybody that's listening to this broadcast to stay up until midnight on New Year's Eve, just to make sure 2020 is gone. So without further ado, thank you for all your efforts this year with Villages Honor Flight. You have no idea how much time and effort is required to make an organization like this run. So my compliments and my thanks to all the volunteers who made us so successful for the year, as well as we can call this successful for a year. But look at the bright side. Hopefully by the end of next year, things will be going again, and we'll get back to what we consider normal, or hopefully whatever is normal. So happy holidays, stay safe, and I hope to see you guys in a meeting fairly soon. So following this, here is Liza Walters.
Okay, Joe, thanks very much. I would like to join with Joe in wishing everybody, happy holidays and a happy new year. And I hope to heaven's sake it's going to be a better new year than this one we've just had. So I just want to keep you all updated and give you all the facts as far as I know them. You probably know that National, Honor Flight National has closed down all flights through April the 30th. Which means we've had to cancel all our spring flights, including the flightless. We just don't have enough time to get everything together. And we always have to follow National's rules. And, we don't know if they may extend the April the 30th deadline. We just don't know. So, as I said, we've cancelled all the spring flights. That means, we cancelled the airlines, the buses, everything that goes into making a flight. Our next projected flight is going to be September the 22nd. Hopefully, we've all got our fingers crossed, believe you me. The pre-flight for that is going to be August the 15th. And right now, it's far, far too soon to tell if we're going to be able to make that. And then the one after that will be October the 27th. And this, of course, all depends on one thing, the vaccines. At the moment, the Pfizer one is out and in distribution, and the Moderna one, from what I've read, is supposed to be approved very, very shortly afterwards. But, we don't know how soon this is going to be rolled out to people like us. We don't know how the distribution is going to, be. So it's all unknown quantities. But just one thing I must say to everyone. We will require vaccines for anybody to go on a flight, not only for anybody to go on a flight, but for anybody to be in contact with the vets. That means anybody who will be attending the pre-flight, medical staff, anybody who has any contact with the vets, but for obvious reasons. The vaccine is 95% effective, which is great, but there's still that outside, chance. So we must have everybody vaccinated. And also what I want to stress is there's probably some of you who are going to be able to be vaccinated in the next month or so because you're at the top of the lists. We will require proof of the vaccine. I can't tell you what that's going to be because I don't think anybody knows at the moment. I don't know if they're going to give you a card or anything. I don't know, but we will require proof of vaccine. And of course, it goes without saying that you have to have both shots of the vaccine, which I believe are 3 weeks apart. So when you get this proof, then you'll relay it to, if you intend to fly, to your, supervisor. For the vets, it's going to be the vet coordinator. For the guardians, the guardian coordinator. For any flight staff, it'll be the staff assistant. And for, other people and club members, it's going to be the club coordinator, which is Al Arnold. So, so as I said, we don't know how long this is going to take. We just have no idea. So that's why we can't make any determinations about flights, right now. We will have to know by June in order to complete the September flight. There's not only the vaccines and our safety, but there's also a lot of things going on in Washington. At the moment, the park police are not issuing any public gatherings license. You know, when we go up on an honor flight, we always have a certificate, you know, enabling us to have a public gathering. And at the moment, the park police are not issuing any of those at all. Also, on top of that, Arlington is closed to visitors. And there's some, you know, doubt about whether when they open, if they're going to allow crowds of people, like everybody who's been to Arlington knows there are crowds of people at each side, you know, everybody, you know, bunched together, you know, shoulder to shoulder. So we don't know if that's going to be able to happen or not. And of course, the park police aren't doing their escort service. So, you know, all these things, it's up in the air. Also, you know, someone told me that the buses were social distancing, and that to have one full bus, you had to have 3 buses because of social distancing. That would be almost impossible for us because we take 3 buses as it is. And so, you know, we'd be having a caravan of buses, for heaven's sake. So, as I said, all these are unknowns, and we're just going to have to wait, you know, until later, you know, to see what happens. We will be flying charters when we eventually start. We'll be flying out of Sanford into Baltimore by Allegiant Airline, you know, who are very, very cooperative with us. And the poor folks at Sanford are really, really looking forward to us. They were all excited almost a year ago when we went up and talked to them. And, you know, they were, you know, really excited to lay everything on for us. And so they're waiting with great anticipation for us actually to arrive there. Okay, what else? I think that's about it. As I said, it all depends. Basically, it all depends on the vaccine. Oh, I know what I was going to say. 2022. We plan on doing 3 flights in 2022. The first 2, one at the beginning of April, one at the beginning of May, will be DC flights. And then the one at the end of May will be the women's flight. We have to put the women's flight in that time slot because, you know, right now we haven't been able to train anybody at all to be a guardian, and we need a lot of the women's vets to be trained as guardians in order to make that flight feasible. They're the plans for 2022, and you know, we're just hoping it all falls together. Hopefully by 2022 we should be back to, you know, kind of normal, you know. As always, as Joe said, our primary #1 consideration is the safety of everyone, of the vets and of all our volunteers. So that's going to be the thing that overrides every single thing that we do. So I want to wish you all a happy new year, and hopefully we'll get to see one another next year, you know, at some time. And as I said, remember, if you get the vaccine, get proof, because we're going to need it. So again, happy new year, and I will see you in 2021. Okay, Al, back to you.
Thank you, Lisa. That was very informative. So as you know, over the past few months, we've been highlighting each of the commission services. We've done 5 before. Today is the 6th, and we'll be doing the U.S. Public Health Service. We're very fortunate to have a retired member of the U.S. Public Health Services, Captain John Golden, who will be giving us a little history about the Public Health Service. So, John, over to you.
The United States Public Health Service, USPHS, is a division of the Department of Health and Human Services concerned with public health. It contains 8 out of the department's 11 operating divisions. The Assistant Secretary for Health, the ASH, oversees the PHS. The Public Health Service Commission Corps is the federal uniformed service of the PHS and is one of the 8 uniformed services of the United States. Its origins can be traced to the establishment in 1798 of a system of marine hospitals. In 1870, these were consolidated into the Marine Hospital Service, and shortly afterwards, the position of Surgeon General and the PHS Commission Corps were established. As the system's scope grew, it was renamed the Public Health Service in 1912. The Public Health Service Act of 1944 consolidated and revised previous laws and is the current legal basis for the PHS. A series of reorganizations from 1966 to 1973 caused a shift where the PHS's divisions were promoted into departmental operating agencies, with PHS itself becoming a layer of hierarchy above them rather than an operating agency in its own right. The 8 U.S. Public Health Service divisions are the National Institutes of Health, the Centers for Disease Control and Prevention, the Indian Health Service, the Food and Drug Administration, the Agency for Toxic Substances and Disease Registry, Health Resources and Services Administration, Agency for Healthcare Research and Quality, and the Substance Abuse and Mental Health Services Administration. Other agencies at which PHS officers work include the Federal Bureau of Prisons, the Department of Homeland Security, Immigration and Customs Enforcement, the Department of Defense, and on active duty military-based hospitals and clinics serving the Navy, the Air Force, the Army, and the Coast Guard. I myself work for Immigration and Customs Enforcement and the Department of Defense on a headquarters level. The United States Public Health Service Commission Corps employs more than 6,000 public health professionals for the purpose of delivering public health promotion and disease prevention programs and advancing public health science. Members of the Commission Corps often serve on the front lines in the fight against disease and poor health conditions. Officers of the Corps wear uniforms similar to those of the United States Navy with special PHS insignia, and the Corps uses the same commission officer ranks as the U.S. Navy, the U.S. Coast Guard, and the NOAA Commission Officer Corps, which go from ensign to admiral. Uniform services pay grades 01 through 010 respectively. I myself made it to Captain 06 before I retired. Active service in the PHS is considered active military service for the purpose of most veterans benefits and for anti-discrimination laws.
Thank you, John. That was very informative to learn all about the U.S. Public Health Service. Well, it's that time of year, and hope you all have a great holiday season. We're certainly all looking forward to a wonderful 2021. Thanks, and have a good holiday. Goodbye.